AI model, risk-adjusted length of stay, LOS, box plot, AI model by Pradeep K. Suri for hospital and patient. The video titled Deep Neural Network for Hospital Patient Care illustrates a deep neural network, DNN, model used for classifying patients into high-risk, medium-risk, or low-risk categories based on various medical and lifestyle input features. Magnifying glass tilted left key components explained. Direct hit purpose. To analyze patient data and predict risk levels, high, medium, low, for hospital care using a deep neural network. 1 input layer, left side. The input layer consists of 16 neurons representing patient data features. Feature name description. Previous hospital visits, count of past hospital visits. Sleep hours/night, average sleep per night. Exercise hours/week, weekly physical activity. Medical history score, cumulative medical risk score. BMI, body mass index, body weight health indicator. Cholesterol level, blood cholesterol measurement. Diabetes risk, diabetes likelihood score. Smoking status, smoker or non-smoker status. Genetic risk, family/genetic predisposition. Age, years, patient's age. Air quality score, environmental impact on health. Oxygen level, %. Blood oxygen saturation. Blood pressure, mmHg, systolic/diastolic pressure. Heart rate, BPM, beats per minute. Small orange diamond mathematical representation. X equals X, X2, X6. This is the input vector to the network. 2 hidden layers. There are 3 hidden layers, each processing and transforming the data using weights and biases. Hidden layer 1. Equation, Z equals WX plus B. Activation, A equals F, Z. Hidden layer 2. Equation, Z2 equals W2A plus B2. Activation, A2 equals F, Z2. Hidden layer 3. Equation, Z3 equals W3A2 plus B3. 8-spoked asterisk notes. The activation function F could be real U, sigmoid, or 10, depending on model design. Each layer refines the learned features further. 3 output layer, right side. Consists of 3 neurons, each representing a risk classification. High risk. Medium risk. Low risk. Bluebook softmax function. The final layer uses the softmax activation function to output probabilities for each class. Y equals softmax, Z3, Y equals \text softmax, Z3, Y equals softmax, Z3. 4 mathematical foundations, left annotations. The DNN design draws upon orange circle probability, for classification, risk scoring. Orange circle calculus, for gradient descent and optimization. Orange circle linear algebra, for matrix multiplication of weights, activations. Orange circle statistics, for feature scaling, normalization, model evaluation. 5 author and attribution. This architecture is credited to Pradeep K. Suri, who is noted as an author, researcher, consultant, and AI/ML architect. His contribution appears to be in designing and conceptualizing AI systems for healthcare risk analysis. Bar chart, end-to-end process summary. 1 input, patient health and lifestyle data. 2 processing, multiple hidden layers extract features and patterns. 3 prediction, output layer classifies into one of the 3 risk levels using softmax. 4 mathematical backbone, relies on key concepts from math and AI to function optimally. A deep neural network, DNN, model like the one shown in your diagram for hospital patient care can generate a wide range of reports and graphs that are useful for different levels of hospital staff, from doctors and nurses to administrators and management. Below is a categorized breakdown. Small blue diamond 1. Patient level reports, for doctors, nurses, and care coordinators. Page facing up reports. Patient risk assessment report. Predicted risk level, high/medium/low. Contributing factors, top input variables influencing prediction. Health monitoring dashboard. Real-time values, HR, BP, oxygen, sleep, etc. Comparison with historical values. Early warning alert report. Patients likely to deteriorate within 24 to 48 hours. Personalized care plan suggestions. Based on predicted outcomes. Bar chart graphs. Radar chart, individual patient health parameter distribution. Trend line, health indicator trends, example HR over 7 days. Heat map, patient risk level distribution by department or ward. Small blue diamond 2. Department level reports, for heads of departments. Page facing up reports. Aggregate risk summary report. Total patients categorized by risk level per department. Departmental health KPI report. Average BMI, BP, heart rate, etc., across all patients. Intervention effectiveness report. Pre-vs post-treatment risk level shifts. Bar chart graphs. Stacked bar chart, risk distribution across wards/departments. Box plot, variation in BMI/BP/HR across departments. Pie chart, proportion of high/medium/low risk patients. Small blue diamond 3. Hospital management level reports, for admin, CIO, CEO. Page facing up reports. Hospital-wide patient risk analytics. Risk concentration per building/floor. Resource allocation forecast report. Staff and ICU requirements based on predicted high-risk load. Historical vs forecast risk trend report. Past vs projected patient risk loads. Preventive care efficiency report. Impact of early interventions on reducing risks. Bar chart graphs. Time series graphs, patient risk trends over months. Forecast graphs, predicted bed/ICU/staff demand. Correlation graphs, between environmental quality and health indicators. Small blue diamond 4. Public health/policy reports, for public health officers, analysts. Page facing up reports. Population health risk map. Aggregated risk levels by region or demographic. Socio-economic impact on health report. Risk level trends vs factors like income, smoking, etc. Bar chart graphs. Geo-heat maps, risk levels across cities or districts. Cluster graphs, groups of patients with similar risk profiles. Bubble charts, impact of multi-factor interactions. Brain AI/ML supportive reports. Feature importance report. Contribution of each feature, example sleep, BMI, to predictions. Model accuracy report. Confusion matrix, precision, recall, F1 score. Bias detection report. Demographic fairness, data imbalance detection. Hospital for clinical staff, doctors and nurses. Page facing up clinical decision support reports. Patient deterioration prediction. Likelihood of needing ICU/ventilator in next 24-48 hours. Treatment effectiveness report. How recent interventions, example medication or exercise, affected risk. Comparative patient risk analysis. Compare similar patients to optimize treatment plans. Bar chart graphs. Individual health score dashboard, bar chart or dial gauge. Vital signs over time, line chart. Deviation from norms, radar chart vs healthy ranges. Health worker for department heads. Page facing up operational efficiency reports. Workload versus patient risk distribution. Helps allocate staff where risk is high. Departmental risk change report. How average risk level changed in last July 14, 30 days. Patient flow optimization report. Predicts discharge vs transfer needs. Bar chart graphs. Department-wise risk trends, line graph with time series. Staff load versus risk heat map. Histogram of patient risk levels. Classical building for hospital administration. Page facing up strategic planning reports. Forecasted bed occupancy by risk class. Predicted resource shortage. ICU beds, oxygen, ventilators, and staff. Admission and discharge risk mapping. AI compliance report. O explains AI predictions using SHAP or LIME, for transparency. Bar chart graphs. Forecast vs actual ICU usage, bar plus line combination. Risk heat map by ward/location. Cohort analysis, grouped outcomes by age/gender. Office worker for HR and training. Page facing up staff optimization reports. Training needs report. Based on mismatches between staff skills and risk level of patients. Burnout risk predictor. Uses indirect indicators, overtime, patient load, etc. Bar chart graphs. Risk versus experience matrix, scatter plot. Staff workload distribution, stacked area chart. Bar chart for quality control and compliance. Page facing up reports. High risk case audit report. Flags discrepancies or gaps in treatment. Response time to risk alerts. Time from AI prediction to doctor/nurse action. Bar chart graphs. Compliance funnel, from AI alert rightward arrow doctor response rightward arrow intervention. Error source tree map, origin of delays or treatment gaps. Chart increasing for business intelligence and analytics. Page facing up reports. High risk population forecast. Risk cost impact report. Estimated cost of treating high risk vs medium vs low. Length of stay vs risk level analysis. Bar chart graphs. Cost per risk category, bar graph with INR. Projected readmissions, line chart. Risk adjusted LOS, length of stay, box plots. Globe with meridians for government and public health authorities. Page facing up reports. Community risk surveillance. By geography, occupation, or socioeconomic segment. Outbreak early warning report. If risk rises significantly in a cluster. Vaccination/intervention impact analysis. Bar chart graphs. Geo heat maps. Demographic risk trends, age, gender, income. Cluster heat map of at-risk groups. Package bonus, implementation suggestion. Would you like me to prepare Python sample code for 1 risk distribution by department? Bar chart. 2 patient risk trends over time. Line chart. 3 top 5 features contributing to risk. Feature importance. 4 individual risk report with gauge chart. Bar chart explanation of the risk adjusted length of stay, LOS, box plot. For doctors and patients. Magnifying glass tilted right what the graph shows. This box plot visualizes how long patients stay in the hospital based on their risk level, low, medium, high. The goal is to help hospital staff, doctors, and even patients understand how risk severity impacts the length of stay. Health worker for doctors. Purpose, evaluate patient care performance and optimize resource planning. Axis. X-axis, risk level patients are categorized by medical risk low, medium, and high. Y-axis, length of stay in days number of days the patient stayed in the hospital. Color coding. Low risk, light blue average stay around 2 to 3 days. Medium risk, orange average stay is 5 to 6 days. High risk, red average stay is 10 to 11 days. Box elements. The box shows the interquartile range, middle 50% of the data. The line in the middle of the box is the median, typical length of stay. The whiskers show the range, from shortest to longest stays, excluding outliers. Clinical insight. High-risk patients require more monitoring, interventions, and recovery time. Helps identify where extra care resources are needed and reduce delays. Can be used to justify hospital bed allocation and discharge planning. Woman health worker for patients. If you are in the low-risk group, your expected stay is short, 2 to 3 days. Patients in the high-risk group may need to stay longer, up to 12 days, depending on complexity and recovery. This helps set expectations and reduce anxiety about hospital timelines. Patients can use this as a reference when comparing treatment outcomes or planning follow-up care. Brain insights. This chart is based on data processed by an AI model by Pradeep Suri, enabling smart healthcare analytics. Actionable outcome. For doctors, prioritize care for high-risk cases with extended support. For management, plan staffing and ICU availability. For patients, understand your position and participate in care decisions. Thank you.